Partners in Health, Redefining the Possibilities of Healthcare. Partners in Health, PIH, is a non-profit organization that was founded in 1987 by Dr. Paul Farmer, Ophelia Dehill, Jim Yong Kim, and Todd McCormack. The organization was created with the mission to provide high-quality healthcare to the world's most impoverished and marginalized communities. Over the years, PIH has become a global leader in the fight against infectious diseases, such as tuberculosis, HIV/AIDS, and Ebola, and has also been at the forefront of providing comprehensive care to people affected by poverty and inequality. What sets PIH apart from other healthcare organizations is its commitment to social justice and its belief that access to quality healthcare is a basic human right. PIH works to address the root causes of health inequities by tackling issues such as poverty, gender inequality, and lack of education. The organization operates in over 10 countries, including Haiti, Peru, and Rwanda, and has a dedicated team of over 18,000 staff members, including doctors, nurses, community health workers, and other healthcare professionals. PIH's approach to healthcare is rooted in the belief that everyone deserves access to high-quality healthcare, regardless of their income or social status. The organization provides a range of healthcare services, including primary care, mental health services, and chronic disease management. PIH also works to strengthen healthcare systems in the communities it serves by training healthcare workers, building hospitals and clinics, and advocating for policy changes that promote healthcare equity. One of PIH's most notable achievements is its success in the fight against tuberculosis, TB. TB is a highly infectious disease that disproportionately affects people living in poverty. PIH has been at the forefront of developing and implementing effective TB treatment programs in some of the world's poorest countries. Through its work, PIH has helped increase the global TB treatment success rate from 50% to over 85%, saving countless lives in the process. Another area where PIH has made a significant impact is in the fight against HIV/AIDS. The organization has pioneered an innovative model of HIV treatment known as community-based HIV care. This model involves training community health workers to provide HIV testing, counseling, and treatment in their communities. This approach has been incredibly successful, with PIH achieving HIV viral suppression rates of over 90% in some of the communities it serves. PIH's commitment to social justice and healthcare equity has also been evident in its response to the COVID-19 pandemic. The organization has been working tirelessly to ensure that communities in the countries it serves have access to vaccines, testing, and treatment. PIH has also been working to address the underlying health inequities that have made marginalized communities more vulnerable to the pandemic. In addition to its healthcare services, PIH also works to address the social determinants of health. The organization recognizes that healthcare is only one piece of the puzzle when it comes to improving health outcomes. PIH works to address issues such as poverty, gender inequality, and lack of education by providing economic support, empowering women and girls, and advocating for policy changes that promote equity. PIH's work has been recognized by organizations and individuals around the world. The organization has received numerous awards and accolades, including the MacArthur Foundation's Genius Grant and the Conrad N. Hilton Humanitarian Prize. Dr. Paul Farmer, one of PIH's co-founders, has been recognized as a global leader in the fight against infectious diseases and was awarded the Medal of Freedom, the highest civilian honor in the United States, by President Barack Obama. In conclusion, Partners in Health is a remarkable organization that is redefining the possibilities of healthcare. Through its commitment to social justice and healthcare equity, PIH PIH has been able to provide high-quality healthcare to some of the world's most impoverished and marginalized communities, and has made significant progress in the fight against infectious diseases such as TB and HIV/AIDS. The organization's focus on addressing the root causes of health inequities, including poverty, gender inequality, and lack of education, sets it apart from other healthcare organizations. PIH's community-based approach to healthcare has been particularly effective, with community health workers playing a key role in delivering healthcare services to those in need. By empowering local communities and building healthcare systems that are responsive to their needs, PIH has been able to achieve remarkable results in improving health outcomes in some of the world's poorest countries. The COVID-19 pandemic has underscored the importance of organizations like PIH, which are committed to promoting healthcare equity and addressing the social determinants of health. As the world continues to grapple with the pandemic, it is clear that we need more organizations like PIH that are willing to tackle the root causes of health inequities and work tirelessly to ensure that everyone has access to high-quality healthcare. The success of PIH provides a powerful example of what can be achieved when healthcare is viewed not just as a medical issue, but as a social justice issue. By recognizing the link between healthcare and social inequality, PIH has been able to make a real difference in the lives of people who have been marginalized and forgotten by traditional healthcare systems. As we look to the future, it is clear that there is much work to be done to achieve healthcare equity around the world. But organizations like PIH give us hope that a more just and equitable healthcare system is possible. By continuing to innovate and push the boundaries of what is possible in healthcare, PIH is redefining the possibilities of what we can achieve when we work together to tackle the world's most pressing health challenges. With its commitment to social justice and healthcare equity, Partners in Health has demonstrated that it is possible to provide high-quality healthcare to even the most vulnerable and marginalized communities. Through its community-based approach to healthcare, PIH has empowered local communities to take charge of their health and has built healthcare systems that are responsive to their needs. PIH's success in the fight against TB and HIV/AIDS is a testament to the power of this approach. By working closely with local communities and training community health workers to deliver healthcare services, PIH has been able to achieve remarkable results in improving health outcomes. The organization's focus on addressing the underlying social determinants of health, such as poverty and gender inequality, has also been crucial in its success. PIH's response to the COVID-19 pandemic has been no less impressive. The organization has been working tirelessly to ensure that communities in the countries it serves have access to vaccines, testing, and treatment. PIH has also been working to address the underlying health inequities that have made marginalized communities more vulnerable to the pandemic. As we look to the future, it is clear that healthcare equity will continue to be a pressing issue around the world. But PIH's success provides hope that a more just and equitable healthcare system is possible. By continuing to innovate and push the boundaries of what is possible in healthcare, PIH is redefining the possibilities of what we can achieve when we work together to tackle the world's most pressing health challenges. In the face of ongoing challenges such as poverty, conflict, and climate change, organizations like PIH will be essential in ensuring that everyone has access to high-quality healthcare. Through its commitment to social justice and healthcare equity, PIH has shown that even the most daunting challenges can be overcome when we work together with a shared vision of a more just and equitable world. One of the key factors behind PIH's success has been its focus on building sustainable healthcare systems that are responsive to the needs of local communities. By working closely with local partners and investing in healthcare infrastructure, PIH has been able to create healthcare systems that are resilient and can adapt to changing circumstances. This approach has been particularly important in the face of the COVID-19 pandemic, which has highlighted the importance of having robust and adaptable healthcare systems. In many of the countries where PIH operates, healthcare infrastructure is often under-resourced and ill-prepared to deal with a crisis of this magnitude. But by building strong partnerships with local communities and investing in healthcare infrastructure, PIH has been able to mount an effective response to the pandemic. Another key factor behind PIH's success has been its commitment to social justice and healthcare equity. The organization recognizes that health is not just a medical issue, but a social justice issue, and that the root causes of health inequities often lie outside of the healthcare system. By addressing the underlying social determinants of health, such as poverty, gender inequality, and lack of education, PIH has been able to make a real difference in the lives of people who have been marginalized and forgotten by traditional healthcare systems. As the world continues to grapple with ongoing challenges such as poverty, conflict, and climate change, organizations like PIH will be essential in ensuring that everyone has access to high-quality healthcare. By working with local communities to build sustainable healthcare systems that are responsive to their needs, and by addressing the underlying social determinants of health, organizations like PIH can help to create a more just and equitable world. In conclusion, Partners in Health has demonstrated that it is possible to provide high-quality healthcare to even the most vulnerable and marginalized communities. By adopting a community-based approach to healthcare, PIH has been able to empower local communities and build healthcare systems that are responsive to their needs. Through its commitment to social justice and healthcare equity, PIH has shown that a more just and equitable healthcare system is possible, even in the face of daunting challenges such as poverty, conflict, and climate change. As we look to the future, organizations like PIH will be essential in ensuring that everyone has access to the healthcare they need to live healthy and fulfilling lives.